When a symptom keeps coming back, the default response for most of us is to look for something else we can swallow. We reach for another pill, drop another capsule in a glass, and hope the dissolving compound will suppress the discomfort. The problem with this routine is that it addresses the surface. It targets the immediate warning sign while bypassing the mechanical cause generating the symptom in the first place. 5 Essences approaches this differently. Instead of asking what else you can take to silence the symptom, we ask, what specific bodily pattern is actually asking for support? The answer is external herbal pouch therapy. It is exactly what it sounds like, a flat, rectangular, stitched herbal pouch. It is worn exclusively on the outside of the body, secured at the navel with a soft, breathable belt. There is nothing to swallow, no new pills to digest, and no needles involved. By shifting the application from inside the stomach to the outside of the abdomen, the goal shifts as well. The objective moves away from aggressively blocking a localized symptom to gently reinforcing the body's overall foundation. This approach is grounded in traditional Chinese medicine, a framework that evaluates human health much like a complex botanical ecosystem. In this tree diagram, the upper branches represent the visible symptom, the erratic pain you clearly feel. But beneath the surface lies the root, the unseen systemic pattern dictating stability. By reinforcing this root network, the volatile branches above naturally begin to study themselves. Achieving lasting balance requires structural support of those unseen biological patterns. Chasing the branches while ignoring the root system that feeds them rarely leads to physical stability. Because every person's underlying root pattern operates differently, a single universal approach fails. The support must be explicitly condition-specific. That is why 5 Essences offers formulas designed for 7 distinct patterns: sleep, nighttime bathroom trips, women's core health, pain, digestion, heart circulation support, and brain vitality. These formulas were developed by Dr. Qingcai Wang, an MD and PhD who built them upon decades of rigorous biomedical research and clinical practice. This matrix outlines the clinical observation of these formulas. Across more than 121 documented patient cases, organized here into those 7 distinct categories, people reported meaningful changes in their baseline patterns. It is important to note the scientific boundaries of these findings. The data is strictly observational, and individual patient results will vary. This documentation moves these external herbal methods into a modern clinical context, where they are systematically formulated and tracked. The physical routine is built to be straightforward. You select your specific formula and use the breathable belt to secure the pouch directly against the navel. From there, the therapy relies on continuity. You wear the pouch continuously, leaving it in place throughout the day and while you sleep at night. Looking at this timeline, you see the replacement cycle. Every 72 hours, you remove the pouch and swap it for a fresh one. As we zoom out, those 3 sequential 72-hour blocks link together, creating one complete 9-day course. This 9-day external routine provides a steady, uninterrupted baseline of support, a continuous physical presence that ingestion-based methods lack. For many patients and their caregivers, managing daily health is already a complex task, involving multiple medications and strict schedules. That is why the goal of 5 Essences is not to replace or disrupt your existing professional medical care. Instead, it is designed to be a seamless addition. It is a gentle, strictly external, and highly intentional tool to be used right alongside your standard treatments. By wearing the pouch, you are leveraging an external application to provide vital internal support. Managing your health shouldn't always require swallowing another pill. It can mean stabilizing your deepest patterns from the outside in.